So May is National Speech, Language, and Hearing Month, and it brings us an opportunity to raise awareness about communication disorders and also the individuals that have those life-altering treatments that help with those communication disorders. So today I have with me Angela Mahan of Life Care Sarasota, who's a speech therapist. How are you doing, Angela?
Doing great, thank you.
Thank you so much for joining us. We're glad to have you. So can you tell me, I guess I've got a couple questions for you. So tell me first, tell us a little bit about your role as a speech therapist and the types of patients that you work with.
Okay, well, in this kind of setting, in the clinical setting, a speech therapist will work with the older population on a variety of diagnoses. It could range from anywhere from a stroke to dementia, Parkinson's, ALS. We work with cognition, which is short-term memory, problem solving, of course with language, which is communicating needs and wants, reading and writing. We'll work with articulation if somebody's having challenges communicating clearly. We'll work with Parkinson's patients with their voice to make it louder and stronger. And we also work with individuals that have difficulties with swallowing. If it might be from a stroke or from Parkinson's, or just if you're getting older, your muscles get weaker. So we work on a lot more than just speech and language in this kind of setting.
All right, thank you. So we also have National Stroke Awareness Month, which is also in the same month. So tell us how the importance of both of these awareness months can help in promoting this idea of speech therapy.
Yes, well, when somebody has a stroke, it can affect different parts of the brain, and depending on where the stroke has occurred, you will have various issues that they have to deal with. For example, if somebody has a left side CVA, you'll see right side weakness, but the left side of the brain will be affected. Those are individuals that have a lot of times various degrees of what we call aphasia, which is difficulty in communicating either with reading, writing, talking, or listening, various levels of that. So we work on with individuals with being able to find the right words or using strategies to be able to write functional information. Also, some short-term memory will occur on that side as well with anywhere in the brain, because there's also lots of areas in the brain that are short-term memory, not just the hippocampus that houses memory. That's kind of the left side of the brain. Now, for individuals that have a right side CVA, which means their left side will be weak, those individuals tend to have a different variety of issues that they have to deal with. They tend to have more short-term memory difficulties. Learning new information can be very challenging. Tend to have impulsivity control, so that they have an idea in their mind, they're just going to follow through without thinking about the repercussions or ramifications of their actions. You'll see sometimes behavioral issues as well. So sometimes they might say things that are not very nice, or kind of think about it as you might have a thought come in your mind and they have no filter, so it's just going to come out. They also have visual issues as well. And for both sides of the brain, if somebody has a stroke, depending on where it is, they can also have swallowing issues, which is what we call dysphagia. And swallowing issues occurs with millions of people in America that they are not even aware of. Because unfortunately, a lot of people that have swallowing issues are either in a nursing home or at home. You don't see them going out to eat because it's difficult to eat for them. And so some of the things that you need to look for if you're starting to develop, because it doesn't just have to be a stroke, you could get swallowing issues because there are muscles in your throat for any reason. Sometimes we just get older and the muscles get weaker. So the things that you want to look out for is if you're obviously coughing, if you feel like food is getting stuck, if you have a wet voice, if it sounds gurgly, if you have a runny nose, if you find it very hard to chew your food, or it's getting stuck in your mouth or coming out of your mouth, any of those things are what we call swallowing issues. And I would highly recommend that you talk to your physician and that you go and see a speech therapist so you can work on those muscles, so you can avoid them being weaker and weaker, ending up getting sick with what we call aspiration, which is where food or drink will go into your lungs, and that can result a lot of times in aspiration pneumonia. So you kind of want to head that off before you have that occur.
That has been tremendously educational. And I hope that our audience has found the value in having this conversation with Angela as well. If you have rehabilitation needs, certainly speech therapy needs, please reach out to Life Care Sarasota for your rehabilitation. Also, I guess I just want to thank you for joining us today. And yeah, it's been a pleasure. And until next time, everyone, we'll see you soon. Thank you once again to Angela Mahan and all the dedicated members of our community who are part of the American Speech Language Hearing Association. Angela's passion for her work is truly inspiring. Angela has been a speech therapist at Life Care Center of Sarasota for 15 years. The rehab team at Life Care Center is comprised of dedicated employees, many of whom have been with the organization for 10 to 20 years. If you would like to learn more about how Life Care Sarasota can assist you or your loved one with speech therapy or other rehabilitation needs, please reach out using the contact information on the screen. Thank you for watching and supporting National Speech Language Hearing Month.